So my name is Jana Kreppner. I'm Professor of Developmental Psychology at the University of Southampton in the School of Psychology. My research interests are on how early experiences, particularly adverse experiences, affect children and young people's development. And more specifically, I'm interested in social experiences like parenting, like experiences with friends, in the broader peer group, and in the community, and how such social experiences, positive or negative, can affect children and young people's lives.
My name is Inge Usman. I'm Associate Professor in Governance and Policy, and I specialize in children's rights, child refugees, and migration studies more generally. My collaboration with Jana started a few years ago during COVID, when we initially worked on a project on the impact of COVID on unaccompanied migrant children. And that project was led by our colleague at Liverpool University. One of the key findings from this project was the mental health dimension of asylum. Therefore, we continued our collaboration on this topic by conducting research with a group of asylum seekers from Albania to understand how the asylum process can traumatize or re-traumatize them when they are here. And then thirdly, the third project we continued our collaboration was this one, looking at how different types of age assessment that are carried out here in relation to child refugees can have mental health implications for this very vulnerable cohort of asylum seekers. So the age assessment pathways and mental health implications was a pilot project funded by New Things Fund via the Public Policy at Southampton office. The main aim of this project, of this research, was to understand why so many children, their ages are being disputed in Dover, so child refugees when they arrive in the UK, and secondly, to understand why so many child refugees are identified as adults, and therefore they enter the system as adults rather than children.
To answer a question around the mental health implications of age assessment, I'd like to start by highlighting that in developmental psychology, we distinguish between different periods in development, like early infancy, childhood, adolescence, and so on. And during these different developmental periods, particular tasks need to be mastered. So, for example, in infancy, children learn to walk and talk typically. In later adolescence and adulthood, young people tend to begin to develop lasting romantic relationships. So, more specifically, in relation to age assessment, it's an attack on young people's identity. During late adolescence and early adulthood, young people move away from their family and orient more towards their peers, and they are reliant on the feedback they get from others outside their family. So being accepted or being rejected, being believed what you say is really critically important for young people's identity. Now think about a young person arriving in Dover and not believed they are who they claim they are, not believed to be of the age they are. It's a fundamental attack on their identity. Moreover, not being believed to be a child results in their being denied access to education, access to appropriate support. And we know from research, for example, in the United States, that encountering discrimination, prejudice, and disadvantage during this period in life has long-lasting consequences on young persons' well-being, on their life prospects.
This project was particularly important from a policy angle because it goes to the very heart of who should be protecting children's rights and who should be deciding their age. Is it the social workers? Is it the immigration officers in Dover? And then most importantly, how can someone's age be accurately determined? We know that in science there is no accurate method to determine age. So we looked at all these key dilemmas and complexities as part of our project to understand the challenges faced by both children who are age assessed, but also by all those professionals who support them as part of this process. So why is this policy area important? This is particularly important now due to the fact that we see significant numbers of asylum seekers and refugees still arriving in Dover, and we know that age assessment will be an ongoing process. Therefore, the question is, how should this age assessment process be improved in a way that it would safeguard vulnerable populations like child refugees, but would also provide professionals with the right tools and instruments to conduct age assessment that is compatible with the protection of children's rights, but also protecting the welfare of everyone involved in the process, including social workers and all the relevant professionals.
I probably have less experience of engaging with policymakers directly. But what we've done is we worked very closely and partnered with third sector organizations and charities who themselves do a lot of advocacy work to promote better rights for young people seeking asylum, safeguard young people seeking asylum. And these organizations themselves have links with policymakers and work with policymakers. So it's in a way that our work is fed forward through our work with the charities to reach policymakers.
So we engaged with all the key stakeholders that are involved directly or indirectly with the age assessment process. So we presented our key findings to refugee charities, social workers, professionals, lawyers, but also to those civil servants in the Home Office that follow closely the age assessment process. And the main aim behind this is to start this constructive dialogue with all the relevant stakeholders to make sure that the research we conduct here at the university could address some of the challenges and obstacles they face in practice when trying to conduct age assessment processes which would be compatible and supportive of children's rights and obviously protecting everyone involved in this process.
Our hopes for the future of this project are to do more research and ideally to follow the young people over a longer period of time to better understand the consequences of age assessment on their mental health. We would like to interview professionals about their views and experiences and challenges, and to assess the costs and benefits for society more broadly.